Well, hello, I'm Joanna Clark with Blissful Baby Sleep Coaching, and I'm here today with Dr. Elise Hamilton of Hamilton Chiropractic, and she is a prenatal and postpartum chiropractor, which is a very specialized area. And in fact, we are both beaming in from the San Francisco Bay Area, and she's one of the only prenatal and trained and certified prenatal and pediatric chiropractors in the area. So I'm just delighted to be with her because she's a very busy woman. And we're here in celebration of W03, which is all about supporting, promoting, partnering, and supporting women-owned businesses in the month of March. And so I'm delighted to bring Dr. Elise here to tell you all about all the amazing things she does as a woman-owned business and as a community member here in the Bay Area. Thank you, Dr. Elise, for being here.
Yes, thank you for having me. I'm happy to share more about what I do.
It's amazing, you guys. She does incredible work. Okay, so let's go back in time. Back in time when you were like, I want to become a chiropractor, right? I mean, and then how did you go from that to, no, actually, what I really want to do is I want to support moms in pregnancy and moms postpartum and those little newborns. So take us back in time on how that became your specialty area.
Yeah, I actually was not on the path of chiropractic when I went to school, was on the path of physical therapy. And I started to work in an office as a chiropractic assistant, got introduced to chiropractic that way, experienced it myself, and really was like, wow, this is amazing. I'm going to switch paths.
Mhm.
And they were also adjusting and taking care of prenatal clients as well as babies. And that was my first interaction to that kind of care. And so I went into chiropractic school knowing that I wanted to really help that population a lot more because not a lot of people know about it. And then it wasn't until I became a mom myself that I was knowing the real benefits of chiropractic during pregnancy, and then was like, this is exactly what I need to do. My calling, we talk a lot about in chiropractic that chiropractic chooses you, you don't choose chiropractic to become a chiropractor. And so I really believe that chiropractic chose me to really bring chiropractic care for pregnancy, postpartum, and pediatric care.
Amazing. And so tell us when you describe prenatal and care, what does that look like? And then what does pediatric care look like? And so if someone's like, wow, do I need that? How would I know if I needed it? Like, could you tell us a little bit about what each of those segments are and then how prenatal into postpartum merges?
Absolutely. So my focus as a chiropractor is the same. I'm looking at areas of the spine that aren't moving well, or any joint really in the body that's not moving well. I help it move better through an adjustment and allow the body to do the rest of the healing itself. So that is the same across the board. If I'm working with an infant or an adult, that is my focus, but the application of chiropractic is very different for an adult and an infant. And so for pregnancy, it really is exciting to work with someone's body who is creating life. And we know all the changes that go on with pregnancy, that we have a lot of low back pain, a lot of pelvis pain, and just kind of overall tiredness and malaise because your body's doing so much. We can also, morning sickness and just kind of that pregnancy waddle, if you have seen or kind of heard about that. All of that is very common, but it doesn't have to be normal. And so I like to let people know during pregnancy, you can have a more comfortable pregnancy with chiropractic care. And so starting earlier through or at the beginning of pregnancy is really going to set up the pregnancy to have a more comfortable pregnancy, but also leading up to birth. And so birth can also be relatively shorter or more comfortable. As
Mm,
well, a lot of my
mhm.
patients report like, oh, that birth was really fast, and oh, we didn't have time for the epidural. I didn't feel like I needed it. I was empowered. And then the postpartum, that usually is much easier to heal from because your body is already um, ready for those changes and prepared, doesn't have all the interference. So your brain can really
Mhm.
talk to the body and do what it needs to do. So often I hear postpartum like, oh, this birth or this postpartum healing is so much better than my first, where I didn't receive chiropractic care. Or even if you had a cesarean birth, that is also going to be helpful to get chiropractic care through that postpartum recovery to help you heal faster. And then
Amazing.
for
Mhm.
infant care, it's very different, very gentle. Lots of babies are comfortable just sitting and letting me work. Some of them will fall asleep while I'm working. I use the amount of pressure to adjust them, the same amount of pressure that you'd use to test or to just put your finger on your eyelid, right? That's not going
So
to be a
gentle.
lot of pressure. Or if you can think about testing the ripeness of a tomato or an avocado, it's very,
Mhm,
very gentle. You don't
mhm.
need a lot of force like you do with adults because they are brand new. But they also have really great results that we can see pretty fast because of that too.
What are some of the main areas that for the pediatric population that you might see in the first 6 months? Like maybe give me the top 3 or 4 reasons why a mother might say, "Gosh, I think my new baby needs pediatric care."
Yeah, so the first is breastfeeding issues.
Mhm.
Lots of latching difficulties, but even if they're not latching, they're spitting up, they're colicky. Constipation is a really big one.
Mm, mm,
I
okay.
have a lot of babies who come in that haven't gone to the bathroom or had a bowel movement in, 6 to 8 days, and that's not comfortable for them.
Mhm,
That is common. A lot of babies can have
mhm,
that. It's just if we didn't have a bowel movement for that long, we'd be very uncomfortable too. We'd be able
mhm,
to go along our day, but it wouldn't be comfortable. So
mhm.
those are the top. But also, birth is very stressful for mom and baby, and so just getting that, whether they were born again through cesarean or vaginally or had assistance with forceps or vacuum, all of those are really stressful on the body. So just to get them having the best outcome of life, the very beginning of life is really important. And so I'm trying to help them have that best start to life they can through chiropractic.
Absolutely. And I also know and had this experience myself that the nervous system post birth is very, especially if it was a difficult birth or a really long birth, is really amped. And so the chiropractic care can really help not only with alignment issues, but also just to literally help the nervous system not have to be so in fight or flight, which then itself goes back to the whole concept, which is let the body heal itself. If the body is in alignment and we've calmed the nervous system down, then the body can do its own good work. And I think that that's really important to think about. Also, babies that have reflux have been diagnosed with reflux or silent reflux can have tremendous benefit of going and receiving pediatric care.
Right.
Torticollis.
Yep.
Um, Also, I think you also mentioned babies with helmets on, that can be helpful to them too through that period,
Yeah, or
right?
before that, yeah, before helmets happen.
Or
So getting,
before helmets happen, so you don't even have to do the helmet.
yep,
So I hope you guys are really starting to see a trend here. And the trend is if you're pregnant, pediatric care, continue it after birth, bring the baby in, getting help with establishing that nursing relationship, keeping all the milk supply going and not no clogs and things like that, right? Establishing
yeah,
the nursing relationship, making sure the baby's nervous system is really regulated after the birth, and helping with their digestive system and continuing that on so that you have recovered from your birth and that your baby has recovered from the birth and that everything is in alignment in those first 6 months. So
Yeah, you
that
said
is
it great.
awesome. Okay. So so now here we are, we're back in time again. She's like, look, I think I want to become a perinatal, a prenatal and pediatric chiropractor. Again, super specialized, you guys, lots of additional training needed for this. You were, so tell us then about how being your own businesswoman. So you knew what you wanted to be as your niche and your forte, and where your passion was, but now how do you go about building a business around that goal?
Yeah, so it's in chiropractic school, we get some business, but we don't get a lot. And so when I graduated, I decided to be an associate in another office another woman who was a chiropractor, and just so that I can get more experience on the business end of it. You know, she had a well-established practice, had a couple different, massage therapists and employees in there. So as I knew where I wanted my practice to ultimately go, I could learn from her and really see the behind the scenes and not just care for people, but also run a successful business. So after that, when I had done my time with her as an associate, I came while I was in Boston. So I moved back to California and started my own practice with all that knowledge and expertise. And it's been a great experience to be my own boss. I wouldn't change it for the world, and to be my own boss, but also a mom, and to be able to have that flexibility is great. So it's wonderful. I knew going in, of course, that was the plan, was to always have my own practice. And so I had to make it happen.
Awesome. So yeah, so again, you guys, because we're talking about W03, which is all about, highlighting women-owned businesses. So Dr. Elise made a decision. She's like, I do indeed want to, this is not by accident, I indeed want to be a female-led business. So when you moved here 4 years ago, you started literally, like, you had all the knowledge and expertise in your field of practice, but you started brand new as a businesswoman in California, in the Bay Area, no less, only 4 years ago, with just 2 of those years being COVID, which was probably very interesting in terms of chiropractic care, because there was, yes, I'm taking patients. No, I'm not. Yes, I am. No, I'm not. Right. All of that because of the California mandates. So tell us, like, who supported you when you came to California and you were building your dream? Like, what other female-owned businesses or individuals or community members that helped you get started?
Yeah, it was a lot of networking first, and really finding a lot of people, that community. So I started exercising with a mom's group, and finding those people that I could find that support. And we have created a mompreneur group from that, that has been really wonderful. Other moms who own their own business, who know the grind of being a mom, but also
Mhm.
owning their business. And so really, as an entrepreneur, you're never off, right? Vacation's
Right.
never really vacation. And so
Mhm.
having that support group really is what drives me and keeps me going, because they get it, and
Mhm.
we can bounce ideas off each other. So that is the number one. And then just getting involved in groups on Facebook has been
Mhm.
really helpful as well. But that networking, really getting my feet wet with talking to people, has been
Right.
the best benefit.
Right. And people live, like, actually
Yeah.
women business owners in your local area, collaborating with them, partnering with them, supporting them, promoting them, and collaborating on all levels. That's amazing.
Mhm.
So when you now think about, being a, women-owned business, and we're kind of coming out of COVID. So now things are really opening up here. I think here in California, our mask mandates literally, I think, went away yesterday, like on Monday.
Mhm.
Um, so when you think about being able to get out and about again, how do you like to partner, promote, and support other female-owned businesses?
I love to do workshops together. Um,
Yeah.
any kind of event really to bring people together. So some
Mhm.
support groups, some just events. We've held pelvic floor workshops, which are a lot of fun. We've held
Mhm.
other like wellness workshops where other female-owned businesses can really come and shine, share their products and things. So that's what I really love, is really to bring everyone together. I hope to have a support group for, postpartum people to really come together, because it's a hard time.
It is a hard
Um,
time. Mhm.
yeah, and holding some classes now that we feel a little bit more comfortable about that. So
Mhm.
in person is really where that connection happens, and so I'm really excited to get more into that.
I know, I do agree. It's as a business owner, a woman-owned business who supports parents, because obviously I'm a baby sleep coach. It has been so hard on the parents these past 2 years not to have the mommy to me classes, the mom support groups, the play dates at the playground, lots of isolation. So I commend you for wanting to really make that be a focus of bringing moms together in these platforms for workshops and wellness workshops and such, and postpartum support groups. That's amazing.
Thank you.
Well, thank you, Dr. Elise. I've so much enjoyed working with you. And why don't you tell everybody where they can find you and how they could reach out if they were like, I need help with pediatric or perinatal care. So tell
Yeah,
us a little bit how we can find you. And I'll put all of this, you guys, in the notes as well. But
great.
why don't you tell
Yeah.
us?
So my office is Hamilton Chiropractic in San Mateo, California. We are online at hamiltonkairos.com. We are also on Facebook and Instagram at Hamilton Kairos. So you can find us both there. It's easy to get in contact with us on any of those platforms.
Okay. And also, I recall one time we were talking about that if a family is like listening to this and they're like, but I'm not in San Mateo, but I
Right.
want to find, I remember you told me that there is something called I think it's called ICPA for kids.com, which what does that stand? International
Chiropractic Pediatric Association.
for kids.
And
Okay,
it's,
so
yeah,
let's
the number
all
4, and that has a directory for all those who are on their registry, have gone through their extra training to work with these populations. I'm also happy to connect you with someone in your area. I
Hmm.
also do a lot of ultrasound therapy for clogged ducts that we didn't mention, but can be really helpful on those stubborn clogs when mastitis isn't really, or you don't want to take antibiotics, or antibiotics is not working. Um, I've helped a lot of people find that in their area too, because it's very limited. So if, yeah, you need
Oh
to find
yeah.
a chiropractor for that reason, or for prenatal pediatric care, I'm happy to help you.
Okay, that's wonderful. So just to kind of repeat that, if you're not in the San Francisco Bay Area and you are having problems with clogged milk ducts and you're getting challenges with mastitis and you don't want to take the antibiotic, or the antibiotics you've taken aren't working, or you are in pain or have recurring events, because it happens sometimes. Once it starts, it takes on a life of its own. um, that Dr. Elise has a special machine. It's amazing. Maybe you could quickly tell us about it, because it's really phenomenal.
Yeah, so it's a therapeutic ultrasound. So we
Okay.
can use that on any part of the body. We just happen to use it for the breast tissue, and it sends heat waves into the tissue to help really unclog and help with inflammation. So if you're having that clog, can be a really, really helpful way to resolve it quickly, once it's come to that point where it's stubborn and not, you feel like that you've tried everything. Um, so this is not well known. A lot of OBs won't even tell you about it because they have no idea.
Mhm.
But a lot of chiropractors across the US are getting into it. So I can help you find someone if you need.
Right. Okay. Excellent. So again, to find Dr. Elise Hamilton, you can go to Hamilton Chiros, CHIROS.com, right?
Yep. Yep.
And also same for Facebook and Instagram. I will also put everything here in the notes. And she is also recommending that you look at, if you're out of the area, ICPA, the letter 4 kids, KIDS.com to find a pediatric chiropractor. And if those of you that have the challenges with the mastitis, you can reach out to Dr. Elise personally, and she will help you find another practitioner in your local area that has the special therapeutic ultrasound that can be I personally have referred many clients to Dr. Elise for that. And it's really life-changing, because when you're in that amount of pain, you really need the support.
Absolutely.
So well, thank you, Dr. Elise, for being such a bright light in our community and for offering so much amazing support and being such a support to other female-owned businesses around your local area and more nationally as well.
Yeah.
So
Thank you for having me and letting me share.
Okay, you guys. So remember, W03 is on Saturday, March 26th. There's no financial requirement. It is just the intention and decision to partner, promote, and support any kind of female-owned business in the month of March, and hopefully also really making an idea on the 26th. And that can be as simple as, if you're listening to this and you love it, share it with a friend, and maybe encourage them to share it with another friend. If you want to write Dr. Elise a Yelp or Google review, because she has actually helped you and you've always been thinking, I really should have done that review and I keep forgetting, we'll do it now, because in the month of March, we are here to raise up the awareness that women-owned businesses do so much in our local communities. We are literally the backbone of our local communities, and we're doing very important work. And they're often solo entrepreneurs or mompreneurs. And we want to partner, promote, and support these incredible businesses doing incredible things for their communities and the people they serve. So put your thinking cap on who you could reach out and say thank you to, partner, promote, or support in the month of March. Thank you so much. And you can go to W03connect.com to sign up to participate or join the Facebook or Instagram or LinkedIn on W03 Connect to get in on all the fun. Thanks so much.